I'm Shelby, here with my co-host Anton to discuss a variety of topics from across the sustainability universe. Anton, how are you today?
I'm doing pretty good. How are you, Shelby?
I'm good. What'd you do over the weekend?
I visited my sister in North Carolina.
How's North Carolina? Did you go birding?
I did go birding. I saw a red cockaded woodpecker, which is like a rare on the federal endangered list, I think.
Wow, good
which
for
is pretty
you.
cool. Brown-headed nuthatch, and I heard the calls of the Northern Bobwhite, but did not see it.
I'm really looking forward to a time when I can identify birds just by sound in the way
Yeah.
that you can.
Well, the call is kind of like the name. The name is Bobwhite, named after the call, because it's like, Bob White? Like, it kind of sounds like Bob White, so yeah.
I want to put a link to like that sound in the show notes so people can compare it. Like I want them to just go back and like
Bob White?
exactly, like
All right, there you
replay
go.
that little
Clip
second.
that, yeah.
Bob White?
Yeah.
I didn't go birding specifically, but I was appreciating birds this weekend because my husband and I went and got pastries at one of our favorite bakeries, Blackbird Bakery.
How about it?
Bird related. And then also took it to a park on Lake Erie. And so we sat and we were like watching the water and looking at the city in the distance, and we could hear and see seagulls.
Yes.
That's one of the only birds I can recognize by sound alone.
Gulls are cool.
Yeah. And
Yeah.
we were sitting there thinking about it and how like the night before we had been hiking in the national park where there were like screech owls and cardinals and blue jays and all sorts of birds that I more associate with Ohio.
Yeah.
That within 12 hours we could hear like the sound of an owl and then also a seagull on the same day. We're lucky to live here.
I think Ohio's pretty cool.
I think so
Very
too.
biodiverse.
I think so too. Yeah, it's a cool
Yeah.
place to be. You want to jump on into talking about some human well-being today?
I would love to.
Yeah, so we're theming it out today, talking about the impact of the environment on health. And so I wanted to start by giving everybody some tools to use to learn a little bit more about environmental health data. Does that sound good?
Tell me about the tools, Shelby.
Absolutely. And just so everyone knows, everything will be linked in the show notes so you can play with these tools yourself. We looked at them a little bit before we recorded. Did you think that they were pretty like user-friendly to get through?
They seemed really user-friendly. I understood the graphs were really easy. The maps were really easy. So, yeah, excited to hear you tell me more.
Yeah. For anyone who's checking them out, there's a lot to look at on the screen, but just like take it slow and really enjoy. It could be fun to even be playing with it as we're talking through and like using an example from your city or county. So first I kind of wanted to talk about what we talk about when we talk about good data and also where you can access really reliable sources of data and some goals that we set about environmental health. This will be pretty US specific because that's where I have access to the most information. So first I wanted to say Healthy People 2030 is sort of this public health resource that we use in the US to talk about goals that we have for health of all kinds. It's not specific to environmental health. It would also include things like high blood pressure rates, cancer, anything related to health. But we have some environmental health goals. So I wanted to talk about what those are.
Yeah.
When you think about environmental health, I'm just curious what comes to mind. Like what would you want data on to back up some of the work that you do with Buckeye Environmental Network?
Ooh, yeah. So, like, for instance, we're really big on, like, people being exposed to radiation, like by radium-226, brine spreading on roadways from fracking. Let's see. Any, like, hazardous, harmful chemicals in particulate matter, like next to any factories or something like that.
Yeah.
So, like, emissions.
Yes.
Those are my two.
Yeah, well, there's a lot of them, and those are definitely two of them. Within the Healthy People 2030 framework, we look at three kind of buckets of data. One is exposure, so exposure to things like radiation, exposure to heat, exposure to chemicals, etc., and there's several measures within that. The second bucket is around neighborhood and built environment, so looking at air quality, pollution. There's some overlap there, right, between what you're exposed to
yeah.
and then what's actually present in your environment.
Yeah.
But interestingly, I thought it also looks at local policies that are related to this. So we consider that a health measure as well, is just have more policies been enacted that would support.
That is so cool.
Yeah, you're a policy guy, so I thought you might like that.
Yeah. I mean, you can't really change much without policy. So.
Exactly. And then finally, we look at, interestingly, also for you, I think, transportation by mass transit. That gets its own little bucket. And so we look at people's commute times. We look at whether they're taking their car or taking mass transportation, or if they're taking their car, are they taking it alone, or are they carpooling, etc. So those are kind of the buckets that at a federal level we're thinking about. Do you think we're missing anything at that federal level?
I feel like that's all pretty good. I mean, off the cuff, I can't think of anything additional that should be added, but
Yeah. There are a couple of other factors that other sources use. So I wanted to talk about two more localized tools that you can use. Healthy People 2030 is a tool, but it's more of, for me at least, a reference to go find out what are the things we're working on, and you can kind of see trends over time. So for example, we can see that in the US there are some improving trends in exposure to certain chemicals because policies have been enacted, or we have safer practices, etc. There's some positive movement there. Not perfect, but in the right direction. But we can see transportation by mass transit maybe is not improving the way that we want it to. So that's how I think of Healthy People 2030. But there's the other two tools that I use in my work as a public health professional all the time.
yeah.
One is called County Health Rankings.
Oh,
That's a wonderful tool to look at where your county compares to the rest of your state or to other similar counties in the U.S.
and how is Cuyahoga where we live?
Not great.
Okay.
So County Health Rankings, this is a super reliable resource. It comes out of University of Wisconsin at Madison. Researchers there compiled all sorts of different data, and they look at all sorts of measures of health. And they're really clear in a way that you kind of can't be when you're viewing a traditional news source about what the data mean, where they come from, and how reliable they are. And I really love that last point because it's really easy, and we do this too, to say a study shows XYZ.
Yeah.
It's not that that's not true or isn't something we should report, but that looks really different than putting that result in context,
Yes.
and having professional researchers and scientists let you know what those numbers kind of mean. So we shouldn't compare these two numbers because they're apples and oranges, or we don't have enough data here for this number to be super reliable. Does that make sense?
Yes, it does.
So in county health rankings, they used to rank everybody, 1 to 100, 1 to 88 in our case, or, 1 out of 250 something when I lived in Texas. Now they'll give you that number, but they're really clear that we're measuring so many different things, we can't really put you in order like that, and instead put you into quartiles. So Ohio is in the lowest quartile.
Okay, kind of like a category, a ranked category, yeah.
Exactly. So you comparably to the rest of the state, Ohio is doing the worst as far as health outcomes, and then we're second to worst as far as health behaviors. So health outcomes being like measures of things like premature death, incidence of disease, and then health behaviors being things like, do you choose to drive to work, or do you get physical activity? But the measures that I thought would be more interesting for us from this environment lens is that it includes some of the things we already talked about from Healthy People 2030, but also things like your food environment. So is food grown locally? Do you have access to it locally? Also access to exercise opportunities or walkability or parks. So this is absolutely about your environment. Do you have a park nearby,
Right.
or is your neighborhood a walkable neighborhood? Also commute times, and also severe housing problems, which is definitely relevant in our county. So things like, could you be exposed to lead in your home,
Yeah.
or insects that might carry disease? So there's a lot of overlap, as we've discussed many times, between the environment we live in and our health outcomes.
Yeah, creating a sustainable city that makes sure that all these health outcomes are maybe not so severe. Like for instance, you mentioned exercise, making sure that you're in proximity to a park, like having green space and having places where people can recreate. Even, I guess, not even like necessarily a park. It could be a basketball hoop, or
Absolutely.
I've seen like in Europe they have these soccer rings that are like these really mini arenas, and like people just kind of hang out and
Yeah.
shoot around.
It's just another reminder that what's good for Earth is oftentimes good for us. So
Yeah.
having a park means that we're sequestering carbon in the trees, but it also means that a person is able to go and take a walk in a place that is safe and beautiful. And so what's good for the earth is good for us.
Yeah. And with you being a health professional, like what kind of differences are there between like somebody who lives in like an urban area versus rural or suburban? Like are these categories higher or lower based on where you live?
When you say categories, do you mean like the outcomes we see in those categories or just what we're measuring?
Yeah, the outcomes that we see in those categories.
There's definitely major differences in what we see in those categories. So we're looking at all the same data, regardless of whether you're urban or rural, whichever state you live in, whatever data are available, we're looking at those. But you're going to see different results depending on where you live. So for example, living here in Cuyahoga County, in Cleveland, we're a Rust Belt city, very old city.
Yeah.
Most of the housing stock was built before the lead paint ban in like the 1970s.
Right.
So there's a much higher rates of lead exposure, which is an environmental hazard, both for humans and also for the greater environment, here than you would see in towns maybe further out west that were built later into our ordinances and laws that would protect us against those kinds of things. And then urban to rural too, you'll notice things like in a rural area, you might have a lower walkability score, for example, because homes are just put further apart. But I think we want to be careful in how we interpret these data and think about what they really mean, because they're coming together as this one big measure of a health outcomes altogether. But there's going to be massive differences in what contributes to that. So when we think about environmental health specifically, you might see that there's higher particulate matter in a more urban core than what you'd see rurally. But it doesn't necessarily mean that we're unhealthier overall than in a rural area.
Yeah, that makes a lot of sense. And like, what would the call to action be for people to use these tools? Like, you're giving these people these tools. What comes next?
Yeah, that's a great question. So I'll transition to talking about my last tool and give you a little bit more about this.
Please.
So we talked about Healthy People 2030. You get your references. County health rankings, you see where you sit within your state. Then one of my favorite tools is the City Health Dashboard. There you can look at your city, but you can also make direct comparisons to other cities. And that's cities, I think, of 50,000 people and above, and they're growing all the time. And you can also compare metrics so you can see the overlap. So we'll get into how you can kind of take action on it. So for example, you're interested in particulate matter.
Yes.
You could go into City Health Dashboard, say, I'm interested in Cleveland, Ohio, because that's where I live, and I want to see rates of particulate matter. And you can even break that into specific neighborhoods and census tracts.
Oh, yeah.
In a lot of cases, depending on the availability of the data, you can break it into different demographics too and see whether it's affecting people disparately, which we know in most cases it is.
And certainly in Cleveland it is.
Absolutely. And you can also compare it to another metric. So maybe you're interested in particulate matter, but you want to compare that to premature death. We did this before the show just to kind of play with it, and you could see correlation between places where there was a higher amount of particulate matter, which was kind of the industrial core, poorer neighborhoods, more people of color living in those neighborhoods, and then also looking at the outcome of premature death, where people were dying younger in those places. So you can sort of use that to draw some conclusions, develop correlations. And then there's also options within City Health Dashboard on like, what can you do? If you go onto the website, you'll see sort of like clicks across the top to go from metric to metric comparisons. You can compare city to city, and one of them is take action. They have examples of specific policies that would help like work on particular measures that you're interested in.
Yeah.
They have guides on how to interact with legislators. I mean, it's pretty all encompassing. I've seen this tool grow from when it was launched really early in my public health career to where it is now. And it's really grown from being just a reference of these are things that we can measure to really an action toolkit so that you as an individual or a larger organization or advocacy body can not just find information, but use it.
Yeah. I mean, I'm all about grassroots organizing. You
I
know
know.
I talk about it every episode. So I hope that some people, some viewers that are watching or listening in can use that, use it accordingly. I think that's awesome.
Yeah. So now people have some tools on how you can see the impact of the environment on your health and what your community is looking like in comparison to others. Now that we know how you can find those kinds of data, let's talk about some impacts that we're seeing of environmental changes on particular people.
Yeah, absolutely. So our next segment, Shelby, is about some recent news. AP, Associated Press, wrote an article about the Colorado River drying up and the states that have struck a deal to conserve that water. But first,
what's a deal? What does that mean?
We'll get into that.
Okay, great.
Maybe. Let's get some background to our viewers really quick. So the Southwest, it's drying out. Groundwater, rivers, reservoirs, and that's because of climate change. Also, because people are using that water, whether that's to water lawns in the desert or to grow crops.
Lawns in the desert. That sounds like an oxymoron.
Lawns in the desert. It's an oxymoron.
I don't think we should have lawns if we live in the desert.
I mean, I'm with you.
Don't let me interrupt you, though.
My friend in San Diego has the artificial turf. You just roll it out. You lay on there. Your dog still pees and poops on it just like regular grass. I mean, it's all the same.
Yeah, we'll have to do another episode on like the life cycle analysis of just like having to take care of your grass in a desert versus like the plastic of artificial turf.
We'll get it from Facebook Marketplace then.
Okay, great.
Okay. Anyways, so yeah, things are drying out in the Southwest. A lot of the veggies that we eat in the winter actually come from the Southwest. So we have a little bit of a stake in this. And thankfully, the Biden administration and Nevada and Arizona and California, they all struck a deal saying, okay, we're all going to collectively conserve some water. And the Biden administration is actually funding, through the Inflation Reduction Act, $1.2 billion to these states to kind of compensate them, help them to kind of enter this new era of conserving water.
How are they going to conserve water? Do we know?
Yeah, it seems like agriculture is going to kind of have the biggest haircut, if you will, of the water. Hopefully, sustaining crops will. Hopefully they'll still be able to sustain crops. I think they will be. I don't know. Maybe some farmers are bad actors versus others. But
it sounds like it's important for us too, because I don't want to stop eating vegetables in the winter.
Yeah, I want my broccoli.
Yeah, me
cauliflower.
too. I'm also
Brussels sprouts.
Oh yeah, root vegetables. Yeah, brassicas.
Yeah, you know that class of like broccoli, cauliflower.
I didn't know that. Thank you for teaching me.
Those are all brassicas.
Great. Okay.
Yeah.
So there's this deal.
Yes, there's this deal. Yeah.
Deal between the Biden administration, 3 states. Are those the only 3 states that are affected, or?
So it's definitely not the only states that are affected. There's 7 other states that are. That actually sit on the Colorado River or are part of the Colorado River Basin. They are, as listed, Arizona, California, Nevada, Utah, Colorado, Wyoming, and New Mexico. It's kind of interesting that those 3 are the ones that struck a deal. Maybe they have the most population of these others, and even a growing population.
Phoenix and LA would be in Arizona and California, so that makes sense.
Yeah, they have that urban sprawl, more people moving in. So
moving into the desert where you got to import your water.
Yeah,
great.
Exactly.
Love to see it.
So to basically sum all of this up, it's a great step towards conserving water in the Southwest. It's not a perfect deal. It's kind of a short-term deal, experts are saying. It'll get them through 2026 before they have to kind of reevaluate and come back to the table and make another deal. Now, who really enforces this? It looks like since the deal is struck with the Biden administration, they're probably going to be holding these states accountable on their usage of water. We're not exactly sure. There's not a lot of reporting on that to date.
Got it. And it's just a deal. It's not legislation. So I'll be really curious to see how it's enforced. But yeah, it sounds like good news, at least a good start. And it kind of shows to me just how important the Inflation Reduction Act has been.
Yeah.
We really I don't think we've really talked about it on the show.
No,
and I don't
really.
see it getting a lot of press for this like enormous infrastructure bill, not infrastructure bill, Inflation Reduction Act bill, that has ended up doing what it wanted to do as far as like making an impact on climate.
1.2 billions, it's a huge chunk of change.
Yeah.
We don't actually know how that's going to get distributed between those 3 states, but we'll be here to update you as we hear more about it.
Sounds like there's a lot of unknowns, but the thing we do know is that it's a good step.
It's a good step forward. So, Shelby, let's hear about the last segment.
Okay. I like to do something a little fun at the end as much as I can. So I wanted to talk today about trees. Does that sound good?
I like trees, yeah.
Yeah. Do you have a favorite tree?
Pawpaw.
That's unsurprising. Yeah. Do you like them all year long or only when they're producing pawpaws as a fruit?
They're a fruit. They're actually very beautiful, ornamental in the autumn. They have a very beautiful golden leaf in autumn. So.
And how does it make you feel when you look at your favorite pawpaw tree?
Happy.
You feel happy?
Delighted. Sublime.
Sublime. Do you feel relaxed?
I feel relaxed and sublime looking at my pawpaws.
I like that. And do you live in a neighborhood? All of this is leading up to something, I swear.
Okay, I believe
you. Live in a neighborhood where there are a lot of trees?
We have a decent amount of trees. It's not one of those streets where you drive down and there's just these beautiful towering oaks.
Yeah.
But we have some decent trees.
Yeah. Well, trees are actually really good for us.
Yeah.
And we've talked before about trees just being a part of an ecosystem. That's important. Keeping birds and bugs and other flowers alive, being a part of this larger environment. But specifically for people, for human mental and physical well-being, trees are incredible.
Yeah. Oh, I bet.
They do so much more than I ever would have thought. And I want to say that this sort of came up for me because I was at the Health Policy Institute of Ohio's annual meeting, or really it was their value dashboard reveal. And so they had a panelist from Green Columbus, which is a really small nonprofit in Columbus that's working on tree canopy. So she started talking about the importance of tree canopy, and it made me want to do more research. So, of course, I did. And it turns out that tree canopy is really important for our mental and physical health, in addition to just being good for the planet. So you said that when you look at your pawpaw tree, you feel sublime.
Yeah, I would say so.
That's sort of an internal feeling. What does your body feel like when you're surrounded by trees?
Oh man, I feel light as a feather, just prancing through nature.
Yeah. Yeah. That is real. I mean, that that's real from your lived experience, but even on a population scale, researchers have looked at what does it mean for there to be trees or not be trees when we're thinking about different health outcomes. And it turns out patients in hospital rooms with a view of a tree have better health outcomes.
No kidding.
Seriously.
That's wild.
Being in proximity to trees can lower your blood pressure. It can improve your mental health.
Wow.
We actually sort of put the benefits of trees into 3 categories according to a Yale study that I was referencing. It reduces harm, so reducing things like air pollution, heat exposure, even crime, potentially. We'll talk about why.
Okay.
So trees reduce harm. They also restore human capacity, things that we might have had before and have lost, like reducing stress, restoring mental cognition, improving mental health. And they also build additional human capacity, like motivating active living. We talked at the beginning about walkability, having a park in your neighborhood. Literally having trees nearby motivates you to be more active. And it also can strengthen our immune systems. And so there's all of these benefits for our hearts, our minds, our bodies, for us to be around trees. And of course, trees are great for the environment because they sequester carbon.
Yeah.
According to the Environmental Protection Agency, U.S. forests removed about 100 million tons of carbon dioxide from the atmosphere every year.
That's amazing.
It's really good. It's
we
good.
Need more forests.
Yes, we do. And we need them in areas that don't currently have them because of unequal distribution. And I'm not just talking about living in an environment where trees grow better. I'm talking about, especially in urban areas, we unequally distribute our trees. There's a lot of reasons for this. We talked in a recent episode about the intersectionality of environment and how different communities are pushed into areas that are more industrial, zoned for industry and manufacturing. Trees are not in those areas where a factory is. Also, low-income communities are relying on community services, and if your taxes are lower in that area, there's less money to care for trees. trees require care. You need people to check on them and make sure they're healthy. You need removal of leaves. You need to remove trees that become diseased.
Yeah.
You have to trim them sometimes so they don't fall on homes. So a low-income neighborhood is less likely to have the funds from the tax base to take care of trees.
Yeah.
And that's a bad thing, not just because we think trees are pretty and they make neighborhoods look nice, but there are actual health outcomes to not having trees in your neighborhood. We talked about all the things that are good about having trees, so think about the opposite of that when you don't have trees nearby. You're not sequestering air pollution.
Yeah.
You're not improving the air where you live. I mentioned crime earlier.
Yeah.
And there are studies that show correlations between areas with fewer trees having higher crime. I'm not going to go so far as to say that the trees prevent crime, but if it's better for your mental health to be around trees, maybe it also means that you're less likely to commit a crime, or the kind of neighborhood that has the money to invest in trees also has the money to invest in people.
Yeah.
And people who are taken care of are less likely to commit violent crimes in the first place.
I think that's totally right.
Yeah.
And sometimes I think trees are so cool. I'm so glad you brought this to the table. Like, just that sublime feeling of being in a forest, hiking through your metro park or whatever. Like, I think that's phenomenal.
Yeah.
And so I don't know. I think we should probably just recommend to our viewers to get out in nature, go experience that treeness and
yeah, that treeness.
Yeah, and talk to your elected officials about implementing, become like a Tree City USA or
Yes.
something like that, so that there's trees in your community as well.
Yeah, Cleveland used to be called a forest city, and there are still lots of trees here, but not as many as there used to be. And as we mentioned, not in every neighborhood. I also wanted to point out that it means that it gets hot and stays hot in your community if there's not tree canopy. So think about the way that trees create shade.
Yeah.
And so they keep heat off. So even as it warms up during the day, you're not having the sun beat down on you.
Yeah.
Whereas you picture like a blacktop or asphalt with no tree coverage, it gets hot and then it stays there.
Yeah.
And so even as it cools off during the night, it's just letting off that heat. And it can be several degrees hotter in parts of town that don't have tree canopy. So it really makes a difference, especially with the warming planet.
Yeah, that makes a lot of sense.
Yeah.
And I think we should do another segment sometime about trees being infrastructure,
yes,
saving us on bills, water and heat and AC, electricity, all that. So
totally.
Yeah.
There are some great organizations that are working on this. The Trust for Public Land is working on putting in more trees. Here in Northeast Ohio, but nationwide, they do really good work on tree canopy. There's lots of organizations that are working on tree canopy because it's good for the planet and it's good for people too. So you mentioned, talking to your legislators, even in areas that are low income where we think there's just not the money to take care of these trees, maybe that is the city or the township, but a county could step in. We can't just say, too bad for you. Right. I think that we have to come together and make the effort to more equally distribute this.
Yeah, 100%. That's what equity is all about. So.
Yeah, absolutely.
Yeah.
Well, thanks so much for talking all things green with me
No,
today.
thank you, Shelby.
We talked about where to find tools. We talked about the
Yes.
Colorado River. We talked about the mental and physical benefits of trees. Where can the audience go if they want to keep up with us and learn more about what we talked about today?
Let me tell them.
All right.
If you'd like to stay connected to us, be sure to follow us on Instagram and TikTok at One Planet Media. That's ONE1. And if you'd like to rewatch full episodes, check out our YouTube channel, All Things Green Show. You can find all of our sources from today's episodes in the show notes.
We'll be back at the same time next week to bring you more news. Thank you for being a part of the global sustainability movement. And then we're tapping.